Most clinicians don't burn out because they don't care. They burn out because they care too much inside of a system that takes everything from them and gives nothing back. But what if the problem isn't you? What if it's the system that's broken and you're just trying to survive inside it? Today's guest didn't just question the system, he walked away from it. Well, it turns out that he was fired and forced into action, but more on that in a little bit. From performing complex urologic surgeries to building a company that's now impacting thousands of patients across the country, Dr. Joe Pazona is here to show you what it actually looks like to step outside the machine and build something better. Welcome to the PA is In podcast, where we discuss entrepreneurship and evidence based tools for translating clinical skills into small business success. Today, we're talking burnout, identity, entrepreneurship, and the uncomfortable truth about staying where you are. If you've ever looked around in healthcare and thought there has got to be a better way, this episode is going to hit home for you. Without further ado, here he is, Dr. Joe Pazona. Most conferences suck. They're impersonal, stiff, a stuffy room full of strangers who won't even make eye contact. You don't need another conference like that. You need connection with a new community. Because right now, you're doing all the things, seeing patients, showing up at home, and holding it all together. And you're wondering, am I the only one who feels this way? That's where the PA Moms Women's Medical Summit comes in. It's a chance to step out of the day to day and actually think about you. It's 3 days in sunny Florida with 36 AAPA Category 1 CME credits. But most importantly, it's a room full of PA moms who get it. You can keep pushing through and white knuckling medicine and motherhood and feeling alone in this quest, or you can choose to do something different. The PA Moms Women's Medical Summit happens in Orlando this summer, July 23rd through the 25th. And yes, there's a PA Mom Prom. Think fancy dresses, photo booth, props, partying, and fun. Save your spot, put it on the calendar. Use your CME budget to connect with a community of like-minded moms in medicine, and give yourself something to look forward to. The link is in the show notes, and be sure to tell them that I sent you. Dr. Pazona, thank you so much for joining us.
Excited. I've been looking forward to this conversation for a couple weeks since we first chatted on the phone.
Yeah, so tell us about you, what you do, what your clinical background is, and what you're working on now.
Yeah, so Dr. Joe Pazona, I'm a board certified urologist, and I'm the CEO and founder of Virtue Care. We partner with rural hospital facilities to build out sustainable outpatient urology clinics. I started Virtue Care about 7 years ago, and I'm sure we'll dive into the journey a bit. And right now, we currently have about 16 hospital partnerships with over 20 urologists working with us, and we are looking to venture into other specialties. So I'm now a full-time CEO, no longer seeing patients.
So talk to me about that transition from seeing patients and doing some of what I'm assuming are these big robot cases, treating the world, curing cancer, making sure people can pee and have sex and all the things that they really enjoy doing. How did you go from practicing urology to being a full-time CEO?
Yeah, it's honestly, Trace, it's been about a 6 year journey and transition. There was no just smooth moment with it. And, part of my entrepreneurial journey has included opening and running my own brick and mortar practice as well. And so when I first opened the practice, I started realizing the power of saying no, because when you say yes to everything, you say no to what's important to you. And so what it looked like initially was I said no to ER call when I opened the practice. And then I was doing everything else, the big robotic surgeries, taking all insurance. And then after about a year of doing that and seeing, wow, I did 10 major cancer cases in the past 12 months, but they took every ounce of life out of me and the stress level. I can't, as a solo doc, do big cases and run a practice. I don't have that bandwidth. So I first said no to major surgeries. Then I reached a bottleneck point and recruited a nurse practitioner to say, hey, I can't see every patient in the clinic. I have to now start saying no to routine follow-ups and spreading my knowledge to other providers. So that was another sort of step back. And then I went through lots of different iterations, won't bore you with everything, but ultimately it got to the point where we were out of insurance with network. I was no longer operating at hospitals. I had a team of APPs. I had another urologist working with us. And I got down to about 2 days a month of coming in, just doing vasectomies in my office. And one lesson I've learned as an entrepreneur, Tracy, is there's a cognitive burden to wearing many different hats that I think a lot of us in healthcare don't realize. We think, well, I could do it all, and you can't. Or if you do, there's a price to be paid. And so it just got to this point where I had lots of signs from the universe of virtue care growing, the cognitive burden, and really the need to really focus down on what I was doing with virtue care that I stepped away back in December. I was ready, no regrets, very comfortable with the decision. I'm now 4+ months in, still really happy. Of course, I missed the patient interactions, but it was time for me to do it. And it was a gradual transition. It wasn't just a one day came in pissed off on a Monday and said, I'm done. I'd slowly been dialing back over almost 6 years.
I'm going to ask you about what the virtue of virtue care means in a minute, but I think that that is something that people really struggle with when they think about walking away from clinical medicine. They either say, I would just miss my patients too much. This is who I am and what I do. I have trained for it. This is the thing that I've been working towards really literally my whole life. Or they say, I feel like I owe it to society, to the patients to show up in this way to take care of all comers in this field without thinking about myself or my own health or sanity. How did you sort of overcome those two things of like, I'm going to miss these patients that I really care about and want to provide care for, and don't we owe it to society to take care of people?
Yeah. Now, listen, it's a great question, and it's one I think that I struggled with for a while, and I think a lot of people do. I think what helped me, I recently dove back into Stephen Covey's 7 Habits of Highly Effective People. And on his chapter about the second habit of starting with the end in mind and sort of defining who you are as a person in your mission statement, he talks about the potential downsides if you pigeonhole yourself too much as a given label. And I think for a lot of us, that is physician, provider, I've got to care for patients. And he even talks about it from the standpoint of separate from job, of just even as a spouse or a parent, that if instead you hold yourself true to certain values and principles, then that cognitive dissonance we face when we're considering a career change kind of goes away. So let me explain that a little bit. I think most of us go into healthcare because we want to take care of people. And we feel this fiduciary relationship to our patients. And then we fall prey to the sunk cost analysis assumption that, well, I've already put this much time into it. I've got to keep doing this indefinitely. But at some point, and I reached this point at various times in my career, I realized that the role I was in and the environment I was no longer serving patients. And it was burning me out, and it was taking away from me. And therefore I wasn't the best version of myself for my patients. And so the way I helped to make that decision was I reframed it and said, how can I, at this stage of my career, create the biggest impact for patients? How can I care deeply for as many patients as possible? And as a single physician walking into a clinic and then going to an operating room and operating, I can only see, I don't know, 25 patients a day, maybe on a real efficient OR day, do 10 surgeries, running nonstop back and forth. What I'm building now with Virtue Care, we're impacting thousands of patients across the country, and it exponentially grows because of a system I'm helping to build and lead. So I think that that's the framework that helped me. And again, it's a very personal decision. For a while, I felt sort of this guilt of like, well, if I'm not in the game and seeing patients, do I lose sort of my cachet? Do I not get to speak about these things because I'm not in the trenches anymore? And for me, again, it came down to a level of focus. If I truly want to make the impact I believe we can make with Virtue Care, I had to just focus on one thing. And I think every smart CEO and business person that I've studied focuses on the one thing. And that's another Stephen Covey habit: keep the main thing the main thing. So those are a couple things that helped me come through that process. But I certainly respect, maybe not everyone's going to get all the signs from the universe that I did, that, December 31st, 2025, it was time for me to step away, and it was a great decision.
I love painting a picture of what that looks like because I don't think we're doing that very well. We see people in clinical medicine and we see people out there doing things, and it's not super clear how to get from I see patients every day, this is what I do, this is who I am, to I'm building something and impacting that. And I particularly like that you're doing this on your own because the path that is laid out for so many clinicians is become a really good clinician, and if you want to, we'll make you a clinical leader, and if you really push, then we'll make you an administrator, and then if you really want to, like maybe someday, hopefully but maybe not, you'll become an executive inside the system. And the system is doing a shitty job taking care of patients, and I think it's really hard to do a good job taking care of patients inside a system that isn't serving them well.
You hit the nail on the head, Tracy. It's a broken system and it's a broken model. And I think all of us can look at colleagues who took that exact stepwise path to the traditional way of earning a living without seeing patients with your medical knowledge. And it's progressing in the broken system with outdated mindsets. And there's a power and, to me, such a freeing benefit of stepping outside of it. The good news is, I kind of get to just figure things out and look at it from a new perspective. I don't have to follow any rules. I don't have to, whereas I think a lot of our colleagues, they go and get like some, Six Sigma black belt Toyota lean training, went and got us some coaching, and now they're, quote, a leader. No, you're not. No, you're not. If you haven't stepped out and run your own organization, you have no idea what it takes. So, I don't love that path. And there's not to say that there aren't some people who've taken that path and have done really well with it. But I think it's going, if we're going to truly fix the model, it's going to take people stepping completely outside and reinventing and looking at it rather than just continuing to feed into the broken machine.
So, is the virtue of virtue care virtuous care? Is it virtual care? What does the virtue stand for?
Yeah, it was both. I was just reminiscing with my wife. I was ideating this concept 7 years ago. It was pre-pandemic. I asked the question, why can't this be easier? Why is it so hard for patients to get in front of the right medical specialists? Why do we put up so many points of friction, whether it's being enrolled with their insurance company, living geographically, fill out this form for the 500th time, wait 2 hours to see me because we have a broken system, and the only way I can make the dollars and overhead make sense is if I double book you and see too many patients in that day. So as I was thinking about that, I was really building initially a direct to consumer telemedicine or virtual care company where I was going to be the initial urologist, cash pay, out of network, just dial me up and let's counsel you on your ED or get a second opinion on your prostate cancer. But I also realized that what makes healthcare unique, the reason why big corporations and PE firms are screwing it up is because there's human beings at the core of healthcare, and it has to be virtuous. Because if we don't have patients seeing physicians and other providers, the entire house of cards comes crumbling down and it all falls apart. And you can put everything on your pro forma and move in your widgets and talk about scale and all these business plans. The bottom line is, unless you understand how to protect that relationship without compromising morals, it all falls apart. And so it just seemed to be the right way to say that we're going to care for people in the right way, but also really break down all those barriers as well.
So, tell me about the work that you're doing as a recovering urology APP. I'm fascinated to hear about this model of what the APPs are doing, sort of boots on the ground, how they're connected with the physicians, and how Virtue Care is sort of facilitating this specialty care at places that might not have access.
Yeah, absolutely. So, as I alluded to earlier, Tracy, initially I thought we were going to be a direct to consumer brand, but I quickly realized that I did not have the patience nor the funding to truly build a direct to consumer brand. And got a very humble lesson in marketing funnels and nurturing leads and all that stuff you start figuring out when you start running a business. So I said, well, what's an easier way to take care of more patients? What's a way I can remove some friction? And as part of my journey, I at one point left to take another job, and we can circle back to this later if you like. And then 2 years later, I was fired. And so within a 2 year time period, I was looking for jobs. And what I found curious was not only were the job postings increasing, now so much to the point there are currently 1,100 job postings for urologists and only 400 residents are graduating per year. But I noticed it was the same jobs. And I said to myself, well, I've been duped by a recruiter. We were talking about this before we jumped online, our love of the recruiting industry. Um, but I'm not going to be fooled again. And so if we have, again, I wasn't an econ major, but if we have a demand of 1,100 jobs, a supply of 400, and then we look in rural America where it's even more, there's more asymmetry because 95% of urologists are going to be either fellowship trained and or join an academic center or large urology group practice. So there's literally about 20 urologists a year who are looking at these 1,100 jobs. And so I said to myself, how can we bridge that gap? So I'm a big believer in team-based healthcare. I think the old-fashioned, quaint idea of one small-town doctor caring for the needs of every patient and community is quaint but outdated. I believe that in a system where we have a limited asset, specifically surgeons and specialists, we need to adopt a team-based approach. So what we believe in is partnering with APPs who are going to be employees of these rural hospitals. We truly invest in their education, their ongoing training and supervision. I don't believe that anyone, whether it be a physician or an APP, wants to be left on an island without the right resources. And we all know that's just not good for patients. So we've created a curriculum and a training program that is really practical that says, okay, forget the 4,000 page textbook. Here's what you really need to know to walk into a clinic tomorrow to take care of about 80% of the problems you'll see. Because as you recall, urology is a lot of bread and butter stuff. Hematuria, elevated PSA, kidney stones, ED, voiding dysfunction. I mean, heck, you just learn those five things, you probably had about 60, 70% of what you'll see every day. And so we invest in their training. I then leverage all of my colleagues who have gone into retirement, whether forced or early, or just said, forget it, I'm no longer going to be a W 2 employee. And they get to work from home. And we strip away, again, all of the admin burden, all the button clicking, all the things that a specialist shouldn't be doing, and pair them with that APP. So on a daily basis, they have huddles, they look at x rays together, they review labs, and there's real case based learning. Uh, that's the best way I've learned in medicine. It wasn't going home and reading a random textbook chapter. It was reviewing who did I see today and studying the patient with pneumonia who I have to go round on tomorrow. And so we've tried to copy that. And then when patients need hands-on care, we'll send a surgeon to that facility to do bread and butter outpatient care. So now the patients can go to their local hospital, see the same face in that local APP, who not only is well trained and is now the resident expert, but is paired with the urologist remotely. So we never sacrifice quality. And then they get to stay in that ecosystem when we send a surgeon who is also part of our team, who's working alongside the two other providers to ensure the patients are appropriately worked up and then the post-op care is appropriate afterwards. So now we're doing 95 to 98% of urology that should stay in rural communities and keeping it locally instead of just letting these deserts exist where 60% of US counties don't have a urologist and patients are stuck traveling for care, or even worse, they don't get care at all.
I mean, to me, that sounds a lot like the orientation and the attending team that you wish you had in very many surgical subspecialties, right? I've been doing this for a long time. And that onboarding is sometimes like, great, we're so glad you're here. Here you go. You know, and that's the opposite of what you want to do when you're taking care of patients.
Yeah, absolutely. I mean, and that's whenever someone, goes, "Well, what about having a doctor there full time?" I said, "Listen, if I could snap my fingers and find that unicorn for you, I'd deliver them by hand, but they don't exist." And so, I've trained a number of APPs with my local practice. It's a lot of work to take my 6 years of residency, my 17 years of practice, and distill it into the essentials, and have the consistency and the bandwidth to do that while I'm running a busy practice, while I've got all my other responsibilities. And so, what's great about our model, Tracy, is our doctors, they're at home. They're not part of a full time practice. Their job is to just teach. And how beautiful would that be if that was the relationship with physicians and APPs from the start? And then to always be there. I still to this day would call colleagues of mine across the country going, "Hey, can I run a patient by you?" So we can't think that there's this cutoff by which, oh, you don't need help anymore. Healthcare is a team sport. It always has been, it always will be. And that's why we're burning people out, is because we're leaving both doctors and APPs on these islands and just saying, here's more work every single day. And then you wonder why everyone's quitting.
Yeah. I mean, if you can see 17, you might be able to see 22. And if you can see 22, why can't you see 25 and maintain the same quality? Like, that is actually, that's a very real conversation that people are having. Like, why would we hire someone new if we could just overburden the people who are already here making money for us? Seems like the great choice.
Yeah. Well, it's something, we shared in our initial phone call. You said it best when you said, the best providers are the ones most likely to burn out, because when you have a high moral bar and a strong work ethic and you're good at what you do, patients are going to like you. You're most likely to say yes to more work, and you just get more and more and more. And while the ecosystem is just, again, a mismatch of supply and demand, we're accelerating the burnout of our best team members. And we just we have to release the outdated mindset of treating each person as an RVU generating worker bee, and instead look at this by a team based approach, looking at leveraging every tool that's out there, because every second that a provider is clicking a button or sitting in a meeting that they don't need to sit in, or seeing patients without the right resources or systems and processes, is a minute you will never get back. This is not, there's no rechargeable hours or minutes when it comes to burnout. Everyone plays a bit, and then at some point when you fall off that cliff, you're out.
Yeah, which is exactly what happened to me. And I think there's a lot of people listening that are going to be refreshed by knowing, hey, it's actually not you. It's that the system sucks and the way that we're delivering care. It's not serving patients, it's not serving providers. And it's really, when we really think about it, it's not sustainable because we don't have enough people, and the current people are leaving faster than we can train and replace. And I mean, as someone who's raising children, I'm like, I don't know what I'm going to do if one of them says they want to be a PA when they grow up. Like, am I going to tell them, hey, listen, see the mom's whole podcast for her experience of what it was like when you were babies and you don't remember this version of mom who was a shell of herself who couldn't show up well for you, which I say sort of laughing because otherwise that still makes me cry thinking about all of those moments that I missed and all of that time that I sacrificed at the altar of a healthcare system that will never love me back, right? Like, that healthcare system, I'm not going to see it graduate from high school. It's not going to be giving me a card on Mother's Day, right? Like, the relationships that we have, both with patients and, outside of healthcare, matter so much more than the revenue that we generate as a clinician.
Yeah, I mean, that's beautifully said, Tracy, and deeply resonates with me, and I'm sure all your listeners. And it's that struggle we go back to from earlier in the conversation of, we still need good people in healthcare to take care of patients, but yet we are, as physicians and APPs, still human beings, mothers, fathers, husbands, sons, daughters, caregivers, and we have limits as well. So how do we combat that? That's the rock and the hard place with this. And That's why I believe the impact that I'm making now is so much greater than me individually seeing patients, because I really feel our model is creating a new paradigm and system for people to truly be top of license, not just something you kind of talk about in a meeting and then ignore the next day when you walk in. Truly be top of license and remove all that friction. Um, and I think that's how we win. That's how we find that. And I also I've got a junior in high school, and she is. I told her one day, I said, "Sweetheart, you would be a phenomenal healthcare professional. You have it all. You are empathetic. You are brilliant. You care deeply. You're humble, comma, but don't think, don't think that going to medical school and residency and as a woman giving up 10 years of your life, that at the other end of it you're going to be rewarded with some big windfall or a pat on the back. Now if you feel that is a calling, do it with understanding what you're getting into. Understand you can make impacts in other ways. There's other ways to care for patients where you don't need an MD or DO at the end of your name. And there's other ways to make an impact in healthcare that are not directly patient facing. So it's tough because, listen, one day I want a great doctor taking care of me when I need him, and I worry 20 years from now, whenever I need whatever surgery I'm going to need, are there going to be enough well-trained people to take care of me and then my kids and so on. So we got to fix the system. That's where it starts, because we don't have a shortage of people who care or who are capable. But if we keep grinding people through a broken system, it really doesn't matter what we do.
Which brings me to another thing I really would love to dig into with you, which is that entrepreneurship is a completely different way to do things than clinical medicine, right? Clinical medicine, we're like, what does the evidence say? What is the NCCN guideline, right? Like, what do we do based on fact, knowing we're doing the right thing? If this, then that. This is the diagnosis. This is the treatment plan. This is the accepted standard. In entrepreneurship, we're just making things up, we're breaking things, we're trying it again. No one is dying, interestingly, because it's not life and death, it's like revenue and systems. It's very different. But in my work with clinicians who are stepping into this entrepreneurship space, we really, myself included, struggle with the fact that there isn't a workflow, that there isn't a template, that there isn't evidence-based business practices that we can follow.
Yeah, I mean, boy, there's a lot we could dive into here. I think just starting off on something you're alluding to, in healthcare, we tend to be risk averse, right? Our bar of of standards is so darn high. Every patient I've operated on expected a 0% complication rate, and no matter what I told them, they expected to just walk out of surgery and have no issues ever again. And if they did, guess who they're blaming? And so in business, you actually have to make imperfect decisions with the best data you have in front of you, and sometimes no data, just on your gut. And you then have varying latency gaps. Sometimes I make a decision today, and I don't know whether it was a good use of my time for a year. I mean, I look back on all the different things that have occurred in my journey and decisions I made. Um, and that's just the nature of business. And it's only a failure in business if you don't learn from it. I look at it as every decision is either going to be a win, or a success, or it's going to be a learning opportunity. It's only a failure if I keep making the same mistake over and over and over again. And that's a very different muscle to flex than in healthcare, where again we're very risk averse. I'm used to, as a surgeon, going, all right, patient has kidney stone, they need that stone out at 4 p.m. today. I'm going in with the ureteroscope, I'm taking it out, I'm putting in a stent. They are stone free, they are done, problem solved. It's very clear and linear. Business is not linear. And so you have to, what I've learned, create a number of frameworks to guide your decision making, because you also can't just make willy nilly decisions. And you can do anything, but not everything. So to me, it's been frameworks that have helped me in this transition.
And from one entrepreneur to another, how does one develop said frameworks?
Yeah, exactly. Well, I'll tell you how, and then I'm happy to share a couple. So how is first off, you got to get curious and humble really quickly. And, it's so interesting, right? I mean, let's all go back, Tracy, to our clinical days. We were curious little sponges. We would read every single book. We would study before rounds. We were taking notes. I would be Friday night studying in the med school library while all my buddies were having fun on their consulting salaries out in Chicago. And but we loved it, and I don't regret doing any of that. And then we go into clinical practice, and we almost just like turn that part of our brain off. I mean, the number of colleagues I saw who were like, "Dude, you're doing the same thing you did 20 effing years ago." Like, come on. That's medicine. Half of what we do today is going to be wrong in 10 years. So you've got to keep evolving. And so the first thing you've got to do is you got to get curious. So I did a lot of reading, a lot of podcasts. I would just reach out for help. I mean, I can't begin to count the number of people whose names I've already forgotten who were kind enough to take a phone call with me asking my stupid ass questions about business. And I've journaled throughout this process, and I look back at like some of my thoughts and business ideas I had. I'm like, you dumb dumb, what were you thinking back then? But it's part of the journey, and so you've got to do things like that. So I think that's the first thing you've got to do is you've got to take action. You've got to own your self education. The answer isn't just go run off to business school. Like that's I'd say the first thing. Is there some value to business school? I believe so, and I'll put it out there. I'm even considering going and getting my executive MBA at this point to fill some gaps. But my MBA of hard knocks and DIY over the past 6 years, I can guarantee is going to be more valuable than if I go do a 2-year executive MBA program, because of all the real life lessons that I've learned. So I think first and foremost, you've got to get curious, and learn from others.
Yeah. Yeah. I can remember that eager, probably delusional naivete, right? Of like you're like headed out on rotation. You're like, I'm gonna change the world, right? Like I'm just gonna, it's gonna be so cool. And like it's just gonna be, but like if you can bottle that up and sort of re-energize yourself into that for entrepreneurship and say like, hey, remember when you thought clinical medicine was like the coolest, most amazing thing? What if we felt like that about business? What if we were like, hey, I'm new here, right? I don't know what I'm doing, but looking around and finding those other entrepreneurs who are like, hey, they seem like they at least have some clues and I have no clues. Like maybe I'll ask them if they can give me a clue, which is how we figured out how to put in a 24 three-way, right? Like it's the same thing as clinical medicine, right? You were like, hey, they need something I don't know how to do. Do you know how to do that? Because you could maybe show me and the next time I'll know.
Yeah, in fact, as you were saying that, it jogged my memory, from an earlier question asking, how do I know I was ready to transition outside clinical medicine? I knew I was ready when business was so exciting to me, and the thought of picking up the latest Journal of Urology or reading an AUA email and the latest NCCN guidelines on prostate cancer was like, that is so boring to me. I have no interest. And if I'm no longer curious in clinical medicine, I probably shouldn't do this because I don't want to be the hypocrite who's doing the same thing that I've done since 20 years ago. And like I said, I'm approaching that 20-year mark. So, yeah, I mean, if entrepreneurship excites you, you start diving in. And again, it's not to say you can't walk that line between still being a clinician and curious there. But if you're truly going to do business and truly be an entrepreneur where you're going to be like, I'm going to go start a company and do this, it's going to take your blood, sweat, and tears. I have probably had more sleepless nights as an entrepreneur than I did as a practicing urologist, and I took call for about 12 years. I mean, it's no joke. It's a different stress. It's a different level of difficulty, than getting yelled at in an OR after working, you know, 30 straight hours and not eating or sleeping or seeing the light of day some days. But it still is a stress.
Yeah, which is an important reminder that I think entrepreneurship is, it's very sexy on the internet, right? Like everyone is like a digital nomad coaching other people to become digital nomads, like, from Fiji. Great, amazing, like good for you. Also, what are you actually doing, right? Like, because it seems to me like it's a lot of hard work. to grow this company and to figure out what you're going to do, how you're going to serve people, how you're going to package it, how you're then going to scale it. Like there are so many what ifs that the people that are telling you it's so easy and you can do it for 4 minutes a day from your phone are maybe not the people that you want to be following in this realm.
Yeah, absolutely. I mean, here's the sexy part of where I am right now. I'm 100% remote. I can go travel every other week and work from anywhere in the world. By the end of this year, I should be have a team in place where I could probably get away with working a couple hours a week, and I should be paying myself more than I've ever paid myself. Here's the bad part. For the last 6+ years, I've gone months without paying myself. I have not slept. I've had to hire and then let go of countless people and be the bad guy who does that. I have burned through probably close to $1 million in making mistakes. I've had to say I'm sorry more times than I can count right now. And I started this journey without any gray hair, and you can see I've got some now. So it's not for the faint of heart. But I say all that not so anyone feels pity for me or sympathy. I've loved it. I wouldn't change a thing. And one practical piece of advice, and this is usually the first thing I tell people as they're considering entrepreneurship as a framework, is number one, you've got to start with your why. You have to decide why you want to do this, because when the going gets tough, and the hospital's now dangling in front of you an offer to get an extra $1,000 a night to take ER call, are you gonna be tempted to go take that, even though that's not in line with what you're trying to build? Or do you feel strongly enough about what you're doing, you're gonna be brave enough to say no, which is another important thing. And so for me, my why, like most people, it's my family. I don't have a golden parachute. Never have. I have to support my 3 children, and I've got to make it work for them. I'm their provider. Second, I'm doing this for my patients and my colleagues. We have a broken system, and I feel like I have the tools to build something better. And third, and most importantly, I'm doing this for myself. I absolutely suck as an employee. I'm not going back into the broken system. I'm a terrible employee. I need to be where I am, and there's no way I will fail. Now, it's not to say I'm not going to have failings. I've had plenty, and I'm sure I'll have more, but this will work. And what this looks like can change, but I always have that North Star of knowing as a framework what it looks like and what we're trying to do and why I'm doing it. And I've gotten a lot better at saying no so I can say yes to my dreams and yes to building something bigger and more important. And so those things may sound kind of like, well, that's kind of BS hippy dippy, but it's honestly, if you don't do those things, nothing else matters.
Yeah, yeah. I believe deeply that this entrepreneurial endeavor, starting this company, starting this podcast, even before it made me a single dollar, saved me from my burnout because I had something that I was passionate about, because I had something that was getting me out of bed and I was energetic and jazzed about, when clinical medicine was the complete opposite of that. So being in the trenches of clinical medicine, being asked to see more and do more and make do with less and see more patients without support, it felt like something that I could control, right? It felt like something that I was excited about sharing with the world. And it did take over as something that I was like, well, this isn't sucking the ever living life out of me. Like, that's also good, right? But I think that having something you're passionate and excited about is preventative for burnout and does help even when you're putting in time and pouring your blood, sweat, and tears into something. If that is something that is aligned, if that is something that you are passionate about and you think is serving the world in the best way possible, or you're on your way there, it's so powerful. And it is an antidote to the burnout that so many of us feel at the bedside.
Yeah, I mean, what's the point of being a clinician if you're a shell of a person when all is said and done? If your family can't even recognize you, if you've lost these moments, there's no takebacks. And I think that most people overestimate the risk of taking action and underestimate the risk of sitting idle. And to me, the greatest risk is doing nothing and looking back in 20 to 30 years and saying, what if? Like, listen, if you quit your job and you go do something and it doesn't work, guess what? The same shitty job ain't going anywhere. There's plenty of need for a great PA and doctor in this country. You'll be fine. You may not be doing exactly what you're doing, but it'll be just as shitty as whatever other job you just had. So people just, again, it's that risk aversion we have as healthcare professionals. We're told trust nobody, sacrifice your life. This is the only way to do things. Don't question any of this. And we just drank that Kool-Aid and said, tastes great, I'll have some more. But it's damaging. And I don't think people sit enough in thinking about that. The true discomfort is doing nothing, and often on the other side of fear is nothing. You take that leap of faith. Very few doors in life are one-way doors, or you can't walk back through them.
I think that that's one of the things that probably got both of us in trouble is that this is one of my favorite phrases. I have questions. Like I have like, oh, we're buying another hospital. Oh, we're doing another, but like, don't worry. And the chief is like, it's actually fine. Call's going to be better now. We have more hospitals and less providers. Call's going to be better. And I'm like, I have questions. Like I just have so many questions about how this is going to work. And if you are that person who's sort of like constantly getting side-eyed in a meeting because you're like, I have a question, you might make a stellar entrepreneur.
Yes. Yeah. My line is that's not how we do things around here. I heard that so much, Tracy, in my employed position, part of a private practice. I'm like, do y'all put this in the employee handbook and I missed that section? Like, is this like something you got to memorize? Because it is unbelievable. This is the way we've always done things. That's not how we do things. And doing the same thing over and over again, expecting different results is the definition of insanity. And we wonder why independent practices are closing down, why people are burning out, why patients are fed up with our broken system. And all we got to do is look at the fact that we've been doing the same thing over and over and over again. And that when the Tracys and the Joes of the world raise their voice, oh, they're difficult.
They're a problem.
They're a problem. And that's honestly what was said to me on the day I was fired. You don't, quote, fit in here. You're a great urologist. You just don't fit in here. In other words, you stood up for what you believed was right, and we don't want to hear that.
We'd like you to go be someone else's problem.
Yeah, yeah. Go be someone else's, quote, problem. Let us get someone in who drinks the Kool-Aid and accepts this broken model.
And we'll do what we need them to do, which is see patients and generate revenue.
No, and listen, I look at that moment as a blessing. I mean, I truly do. I don't say that in any sort of trite or vengeful way. How lucky was I was given that gift where I was forced into action because I can very easily sit here and proselytize, take action, don't be afraid. I was fearful for years. Tracy, I have no doctors in my family. The only guys in business make pizza. I had no business background. I was a psychology major. I literally said coming out of training, I don't want a thing to do with business. I just want to go be a urologist. I'm going to let everyone else handle that. And I then realized the downsides of that mindset. Um, and so, yeah, I think your advice is sound. If you're the person who's like, am I the crazy one? Why are we keep doing this? You're probably the entrepreneur and you need to get out, And if you're in the system and you're happy and thriving, God bless you. Thank you for doing the work that you do. I hope you're excellent at what you're doing because I'll need you as a doctor one day. So, keep going. But I think there's more people like you and I than the latter.
You are a delightful follow on LinkedIn. Where can people go? Is that where you hang out and share? Where can people go to say, I have questions, right? And like, we don't want to do it like that anymore. Is LinkedIn the best place to follow along and connect with you?
Yeah, definitely, Tracy. Dr. Joe Pazona on LinkedIn. I'm sure you'll have a link to my profile. I usually go on and have a daily rant. I'll usually piss somebody off with one of my posts or comments, but listen, we just need to have real world discussions. We need to come up with solutions, and that's ultimately what I'm looking at. I'm not trying to be ornery or try and build up a social media following. I'm trying to spark actual discussion, and I'm trying to show the clinicians you have other options. You don't have to sit idle. You don't have to keep going with this broken system. And I'm also trying to be empathetic and reaching out to our health executive colleagues, going, listen, I I appreciate that you have a harder job than most people give you credit for. You have stresses that I can't even begin to understand due to regulations and reimbursement and razor thin margins and pressures from multiple stakeholders and some difficult doctors on your medical staff, I'm sure. So, how do we bridge that gap? Because at the end of it, instead of fighting with each other, let's identify the common enemies. I'm talking to you, United Health Group. Let's identify, more importantly, the common hero, who are our patients. And that is what we need to focus our efforts on instead of arguing over titles and names and who's wrong and who's right. Let's come together because there's a lot of wonderful, well intentioned people in healthcare on both sides of the table. And when we work together, beautiful things can happen. But as long as we're not bridging that gap, and one end is just the difficult burnout people grinding away at patients, and the other end is sitting in meetings all day complaining about the difficult doctors, we're not going to get anywhere.
And if you don't leave this episode feeling inspired, we can't help you.
Amen, Tracy. Absolutely. We're listen. Your energy is infectious. I was so happy that you asked me to be a guest here today, and I hope that some of your guests get something out of this. And in all seriousness, please shoot me a DM on LinkedIn, especially if you're a clinician. I absolutely respond to those messages and have taken countless phone calls with people with no expectation of payment or getting anything back in return. And that's my way of paying it forward for all the countless people who helped me early in my journey. So I would love to help folks and see if there's some little nugget of advice I can give. But Tracy, you're awesome. Keep doing what you're doing. This has been an absolute blast.
Thanks so much for coming on. We really appreciate it. If this conversation stirred something in you, good. That's not just restlessness. That's information. And I want you to file it away and think about taking action. Because as it turns out, the biggest risk isn't leaving medicine. The biggest risk is staying exactly where you are and wondering, what if, when you look back in 10, 20, or 30 years? You don't have to burn it all down tomorrow, but you do owe it to yourself to start asking better questions. And if you're that person in the meeting, in the huddle, in the rounds, thinking, this doesn't make sense, there has to be a better way, you're not the problem. You might just be the one who builds the solution. That's all for today. This PA is out.